Guys, this is my absolute favorite part of being a doctor. Do you guys know that? Because today we're going to go over what lies within inside you, which is a health and healing power. We're going to unleash that power. Now, most people, when they come to the chiropractor, they go to the chiropractor for what reasons? Neck pain, headaches, sciatica, some type of symptoms. But when stuff like their digestive issues clear up, or they're coming off their high blood pressure medication, or their diabetes clears up, they don't know why a lot of times. And that happens a lot in this office due to the corrective chiropractic that we offer. Now, also even worse than that, when the pain goes away, they stop coming in. And you know who was one of those people? When I was 18 years old, I was 17. I was training for football. I had scholarship offers for football and wrestling, and I was in the middle of preseason training. During the training, I developed mid-back pain. It was so bad. I was taking Advil. Guess what? The Advil stopped working. I went to my mother and I said, Mom, I don't know if I can play football this year to the level I need to get the scholarship offers that I want. So my mom took me to a chiropractor. I went in, I met with the chiropractor. He took a set of x-rays, but he never sat me down in a workshop setting like you guys are doing. He never explained to me what normal x-rays looked like. He never explained to me what my x-rays looked like. He just said this: you're messed up, and I want to see you one time a week until the problem's fixed. Guess what happened after 3 weeks? The pain was completely gone. Did I go back for the 4th week? I did not. I did not see a chiropractor until 5 years later. Now at this point, I just finished my senior year of football. I was at the medical doctor's office for a routine physical exam. And I walk into the medical doctor and I am 270 pounds, I have no energy, and my mood is flat. They run a blood pressure test on me. They say your blood pressure has now been elevated on 4 visits in a row. If it's not fixed on your next visit, we're going to place you on an ACE inhibitor or lisinopril. Guys, I am, at this point, 23 years old. I'm being told to be placed on a high blood pressure medication. Who knows somebody on high blood pressure medication? When somebody's given a medication, do they ever end up on just one medication for the rest of their life? No, they get more medications, because every drug has what? Side effects. Except I don't call them side effects, I call them direct effects, because each drug has one. So I'm sitting here at 23 years old and I'm thinking, I'm destined for a life of drugs and surgeries. I'm not going to live that epic life I wanted to. But luckily, at this point, I was given the gift of pain. You guys heard me right. I said the gift of pain. Your pain is a gift. Your symptom is a gift, because it drives you to do something, to transform your health. And it drove me into another chiropractor's office. Now, at this chiropractor's office, he took a set of x-rays. After he took the set of x-rays, he sat me down in a workshop setting just like you guys are in. He explained to me what was wrong with my x-rays, but more importantly, he educated me on the fact that I am in charge of my health. Which is true, right? Are you guys in charge of your health? Absolutely. Now, the medical system doesn't want that to take place. They want the pharmaceutical industry to dictate you being on drugs, medications, surgeries for the rest of your life. There's no money in keeping people healthy, right? So he told me that I was in charge of my health, and that I had to see him 3 times a week in order to get changes to the spine. So I started seeing him 3 times a week. Guess what happened after a few weeks? No pain. I felt great, better than I ever had my whole life. Did I go back? I kept going. Guess what? My blood pressure cleared up. My energy came back. I even lost the weight, grew a little 6-pack. And when I was at the medical doctor's office the next time, he ran the blood pressure test on me. He said, your blood pressure is 118 over 65. Your resting heart rate is 46 beats per minute. You're one of the healthiest people I've ever met in my life. And I then did a complete 180. I decided I no longer wanted to become part of the medical profession. I wanted to become a chiropractor so I could tell as many people as possible about the true health and healing nature inside of you guys, about getting to 100% health and living your epic life. And that's what it's all about, guys. In this office, we have one goal and one goal only, and that's getting you to 100% health. Except in this office, whenever I say the word health, I want you to think of the word life. It's about you expressing 100% of your life potential. So obviously we have death on this end, that's 0%, right? Now we don't think about our health until when? A symptom arises. In order for a symptom to arise, you have to have 60% damage for that to appear. Once the symptom appears, what is the purpose of it? Yeah, the symptom is a warning sign. It's to say, wake up, Johnny. It's time to do something about your health, man. You've been neglecting us for way too long. And when a symptom arises, where do most Americans go? Not usually the hospital right away. In 2021, we're probably going to go to Dr. Google first and start typing stuff in. Or we'll start walking down the hallways of Safeway, King Soopers. We're not looking for grass-fed beef, organic vegetables, and wild-caught fish. We're looking for Tylenol, Advil, something to do what? Suppress the symptoms. So do we feel good? Yeah, temporarily. But is the problem going to get better or worse? It's going to continue getting worse. Now, as it gets worse, we're going to end up going to, as it gets worse, then we're going to say, you know what? I need an opinion. I need an expert to look at this. I'm going to go see a medical doctor. Now, the medical doctor is going, now here's how the medical system works. You walk in with a symptom, they sit you down, they run a series of tests. After the test is done, they're going to sit you down, they're going to say, James, there's nothing wrong with you. Here's your medication. Now, could that possibly be a true statement? If you go into the medical doctor with the symptom, could that possibly be true that there is nothing wrong with you? No. Here's what the medical system is meaning to say. Congratulations, Evelyn. You don't have a disease. We should be celebrating that, right? Like, yes, I don't have a disease. But they don't tell you that. Why do you think that is? If I was to say to you guys, congratulations, you don't have a disease, but you have a symptom, what would your next question be to me? How are you going to fix it? Or, what the heck is wrong with me then, dude? And then you would get 3 words that you're never going to hear out of the medical doctor. I don't know. But here's your medication anyway. So you're going to take that prescription medication, which is going to cover up that symptom, so you feel better temporarily, but is the problem getting better or worse? It's going to continue getting worse. Then we're going to say, you know what? I've had enough of that doctor. I need to get a second opinion. So now you're going to go to another medical doctor. Maybe it was lack of testing why you had the problems. So we're going to do more advanced testing for a more advanced cost. Still, nothing's wrong with you. So you might go to a 3rd doctor, 4th doctor. Now, how are you feeling along this process here? Not very good, right? So then we go to the medical doctor that looks like a genius, the last one. A lot of times this is the specialist. Because he's the one that sits you down and says, we found it. You now have a diagnosable condition. You have a disease that we can label you as. So now we transition from the management of symptoms to the management of disease. You have to have 80% damage in order for a disease to manifest. So let's say we originally had low back pain. We couldn't figure out what's causing it. Then we eventually go to the medical doctor that looks like the genius. And is he actually a genius? No, he's just the last one. And he says, we found it. You have prostate cancer. So we're going to go in and we're going to remove the prostate. Who's happy the cancer's gone? We're all happy, right? But 9 times out of 10, the cancer does what? It comes back. Because the medical system is not asking an important question. Why are you not healthy in the first place? Why was the cancer able to manifest to begin with? Now guys, am I anti-medicine? I am not. Now do you guys know who Dr. Ray is? Dr. Ray was just in a severe car accident. Dr. Ray, did he go to see me after the car accident or Dr. David? Absolutely not. He went to the hospital because it was an emergency situation. Now, the medical system works very well in times of crisis and times of emergency. The medical system is very good at keeping you not dead. You can stay alive a long time with drugs and surgery, does that sound like a life well lived? Does that sound like 100% life or health? So how do you know when you're at 100% health? You're not sick, right? When you're feeling good. Who likes feeling good? I love feeling good. I can't base my health on how I feel. So how do you feel here? You still feel great. The difference between you and a symptom is time. Between that symptom and disease is time. So the true definition of health, guys, is written in the word. Look at the word health. Now circle the first 4 letters. What does that spell? Heal. Health is about how your body heals and how your body functions. So if health is about how your body heals and functions, then what controls all healing and functioning in the body? What controls everything in the body? Absolutely. The brain does. The brain sends electrical signals down your spinal cord to every organ, cell, tissue in your body. So in order for you to see me, in order for you to be breathing, for your heart to be beating, your brain is at work and you guys don't even know it. Now when it comes to the brain, it controls 100% function. And this is basic physiology. Structure dictates function. And you have a normal structure to your spinal canal, which is designed to protect your spinal cord and also develop structure for the rest of your body. And then normal structure is 45 degrees. We have to have a 45-degree curve in the neck, mid-back, and low back. And simply, this is the strongest structure within engineering. You're designed smartly. Do you guys know that? So a 45-degree curve is normal structure. So if 100% structure equals 100% function, what happens if we lose that structure? Loss of function, right? Now that's what we call a subluxation. When your spine is out of alignment and then you put pressure on a nerve. So if you lose 60% function, you have a symptom. And here's how it works. The base of the skull here, these nerves control the blood supply to your head. So if you have over 60% damage to that nerve, you have migraine headaches. Who knows somebody with migraine headaches? When a migraine headache arises, what does the person say that has them? I have a migraine. Lock me in a dark room that's quiet because I'm sensitive to light and I'm sensitive to sound, right? The same nerve that controls the blood supply to your head is going to your eyes and your ears. If we go a little further, mid-neck area, the nerves here, at over 60% damage, we have neck pain. Under 60% damage, no symptoms at all, but the nerve here goes to our thyroid. So if you go to the medical doctor at this point and they run a test, they're going to say, welcome to the world of hypothyroidism. Here's your levothyroid. Here's your synthroid. You're going to be on this for the rest of your life. That's not true. People come off of medication every day in this office once we get to the cause of the condition. If you go a little further, upper back area, base of the neck. This is where people say they carry their stress a lot of times. These nerves here are going down our arms. So if we have over 60% damage to that nerve, we have numbness and tingling down the arms. Guess what I went to the chiropractor for when I had the second time? Numbness and tingling down my arms. Under 60% damage, no symptoms at all, but the nerve here is going to your heart. So if only 40% of the information is getting to your heart has to do what? Work harder and work faster. If you go to the medical doctor at this point, they run a test, and what do they say? Welcome to the world of hypertension, high blood pressure. Here's your ACE inhibitor. You're going to be on this for the rest of your life. We're going a little further. Mid-back area. Over 60% damage here, we could have mid-back pain, rib pain. Under 60% damage, no symptoms at all, but the nerve here is going to our pancreas. Our pancreas secretes insulin. Insulin regulates blood sugar. If your blood sugar is unregulated and you go to the medical doctor, they run a test and they say, welcome to the world of type 2 diabetes. Here's your metformin. Here's your chromium. You're going to be on this for the rest of your life. Last area, The most common area to see disc degeneration here is in the low back. Over 60% damage, low back pain, radiating down the legs. Under 60% damage, no symptoms at all. The nerve here is going to our bladder, our prostate, our reproductive organs, and our colon. And here's what this looks like in an MRI. You guys see this right here? This is a 45-degree curve. This is healthy. You guys see how fat the discs are here? You see how fat the spinal cord is? When we lose that curve, the spine becomes straight. You see how the discs are thinner now? But look how thin that spinal cord is. This is 50% damage. How much pain is that person in? Remember, you have to have 60% to feel it. He has no pain at all. So what does he do about it? And then it goes to phase 2. Now we have wearing down of the disc. Look how thin that spinal cord is now. If we continue to do nothing, it then goes to phase 3. Now we have pressure on the spinal cord, not only putting pressure on the nerve going to your thyroid, but affecting every single nerve and every single organ below that, which is which organs? Every single organ in the body. So this is what this looks like from the top. So if I was to take an MRI image looking at your spinal cord from this view here, this is a 45-degree curve. You guys see how fat that is? This is like a 5-lane highway where every single car is driving 80 miles per hour at least. How fast is traffic moving? Traffic's moving great, right? This right here is as if we took 5 of those lanes and did road work to 3 of them. We're down to 2 lanes. How's traffic moving? It's backed up. Except what's being backed up now is information from the brain to your heart, brain to your lungs, brain to your digestive system, brain to your immune system. Whatever cell, tissue, or organ that brain is communicating with. So on an x-ray, what we want to see, 45-degree curve, nice fat disc. We don't want to see, you guys see the reversal of the curve here? We don't want to see that. What happens when this is untreated is this here. You guys see these discs? They're thin. You guys see that bony changes there? That's called degenerative spondylolytic osteoarthritis. Say that with me. We're not going to say that. We're going to call them bird beaks to be short because he looks sort of like bird beaks, right? So we don't want to see bird beaks. That tells us the number of years the damage has been there for. So guys, this was a patient in the office. Does she have a 45-degree curve?
Phase 2.
Phase 2. Is she healthy or is she sick? Well, she's sick. She was seeing another chiropractor for 10 years though. While underneath this chiropractor's care, she developed neck pain, headaches, and also acid reflux. After 6 months in our office, her spine looks like this now. Is she healthy or sick or not? Absolutely. Guess what? Is the neck pain and the headaches gone?
Yep.
Is her acid reflux gone? Absolutely. Now, why were we able to get changes but the other chiropractor wasn't?
Good question.
There's a few reasons. First off, that chiropractor never took a set of x-rays. So if I never take a set of x-rays, how can I take a set of post-x-rays to show you that you're getting the results you deserve? Or how can I give you care without guessing? To know is to see, right? So we took a set of x-rays. Also, this chiropractor was in network with an insurance company. Has anybody ever wondered how a doctor becomes in network with an insurance company? You sign a contract. And in that contract, you're signing your right to essentially treat the patient the way you want to. You're treating the patient the way that the insurance company wants you to, the way you're going to get paid for it. And if I'm signing a contract with an insurance company, am I working for you guys or the insurance? And who do you want me working for? For you guys, right? So this insurance company told this lady here she could be seen 1 time a month, 12 times for the whole year. I don't know about you, but can you work out just 1 time a month to get healthy? You wish, right? Can you eat just 1 healthy meal a month to be healthy? Absolutely not. Everything in human physiology works through repetition and habit. So repetition, we're getting changes to the spine. We're starting off at 3 times a week. After looking at your guys' x-rays, we're starting off 3 times a week too. Now, I love you guys. I've met all of you. I know I love you guys. But do I want to see you 3 times a week for the rest of your life? Absolutely. Absolutely not. We want to get changes. We want to get the spine corrected. That's the first phase, is correction. So the 3 times a week is for momentum. But after we get changes to the spine, how long do you want to maintain that for? How long do you want to be not only pain-free, but also have increased energy, more productivity, clearer thoughts? For the rest of your life, right? So after we get correction, we then do maintenance then after that. Sound good? All right. Getting correction to the spine. It's all about the 5 essentials, guys. So number 1 is chiropractic care, what you guys came here for, right? So if we're starting off at 3 times a week, what does that mean? 3 times a week. We cannot expect to get changes if we are missing adjustments. Do you guys have vacations planned? You guys have work to do? So are you gonna miss adjustments? Absolutely, but we never cancel, we always reschedule. Make sense? We also need to help support those adjustments, to hold those adjustments in place. So this right here, now this is a front view of the spine. Do you guys see the unleveling of the hips here? Do you guys see the twist in the spine? This issue is due to a problem with the foot. So if I have a collapsed arch in the foot, my knee gets thrown out. If my knee gets thrown out, my hips are out of whack. If my hips are out of whack, I have these nasty twisted turns in my spine so I can stay even with the horizon. So if I adjust your spine all day long but don't take care of the foot issue, what is the problem going to do? It's going to keep coming back. So that's why we're going to get you a custom set of orthotics to then even out the hips. Do you see how the knees are turned in with this patient? Throw the orthotics in place, and now they're even. We also need to make sure that during your sleeping hours, we're influencing a 45-degree curve. So this pillow here, what do you think this curve's set up for? It's a 45-degree curve. If you're not a back sleeper, but you're a side sleeper, either side is designed to keep your head even. Because we want to be completely straight from the front and 45-degree curves from the side. Home care. Who woke up this morning and brushed their teeth? We call that what? Dental hygiene, because you don't want cavities. You don't want to smile in the mirror and see a bunch of cavities, do you? Now imagine if you could smile in the mirror and see this here. You'd be brushing your spine too, right? So we are going to start practicing spinal hygiene. Now this allows you to get changes faster. To get correction in the spine, it used to take us 14 to 16 months. Now due to the spinal home care, we're getting those results in 6 to 8 months. So it helps us get changes faster. So we have to be doing our spinal home care. Nutrition. Our job is to get the brain talking to the body at 100%. Once the brain's talking to the body at 100%, so I want it talking to crappy cells, crappy tissues, and crappy organs. I want your brain talking to live, vibrant cells. So we're going to do the advanced plan eating. Now when it comes to the eating plan, the most important aspect when it comes to your healing is inflammation. We have to make sure that we're controlling inflammation to decrease pain and also expedite healing. And guess what? When you decrease inflammation, you actually turn back the aging clock. So you're going to get younger as well. We're also going to get, this is really cool, this is called maximize metabolics. What we're going to do is we're going to send a urine sample out to the lab. Now we always do urine before we do blood because it catches nutritional deficiencies and toxicities before blood does. So we get the urine test, we interpret the results, then we're going to sit down and we're going to create a customized nutritional plan for you. So I might need CoQ10. James, you might need adrenal energy. Johnny, you might need magnesium. It's going to be different based upon whatever we're seeing in those lab results there. Oxygen and exercise. Is exercise good for us? We've all been told that, right? When it comes to exercise, though, we think we need to be exercising for 1 hour, 2 hours, 3, 4, 5 days a week. And that's not true. We created a program called Max T3. And it utilizes an approach known as the minimal effective dose, which means you get the most benefit in the least amount of time. And that's 12 minutes, 3 days a week of high intensity training. That's going to help you increase the muscle mass, lose body fat, and also regulate hormones to expedite healing even further. Minimizing toxins. Do we live in a toxic world? Absolutely, whether it be the stuff we put on our skin, in our bodies, the stuff they package our food in, the stuff they spray in our food. We are marinating our body in toxins. So we're going to pull the toxins out of our bodies through a detox program. We're also going to pull them out of our homes as well. mindset. I saved the best for last. This is the most important one. Because when it comes to mindset, knowledge is power, right? I tricked you guys. Knowledge is not power. The application of knowledge is power. You guys have to make sure you're applying everything you're learning in order to get the changes you want. Now, when it comes to increasing your knowledge base, we're going to do workshops, seminars. We're going to send Facebook, YouTube videos to you guys. So you guys are just armored with information on health and healing. But more importantly, you can then educate friends, family members, and people that need it. Because if people aren't inside of this office, what are they being fed? Drugs, surgeries, you're broken, you're designed to degenerate, and that's simply not true, right? So who's going to tell them? You guys are. So the last few things we're going to see are some x-rays here. This patient here, healthy or sick? You see how straight her spine is? Look at the degeneration of the disc. She came into the office on her first visit. She showed us that she had a scar on her chest. The reason for the scar was the fact that she had a heart transplant. She was told by the medical doctor that she had 6 months to live because her body was rejecting the new heart. After 6 months in the office, though, her spine looks like this now. Is she healthy or sick? She's still alive after 6 months because we allowed the communication between the brain and the body and health happens. Guess what? 10 years later, she got adjusted in the office. This week, actually. It wasn't today, it was yesterday. So she's still getting adjusted to this day. Next patient here, healthy or sick? Look at that degeneration. She came into the office with her husband. She was on 7 different medications. She had neck pain, headaches. She wasn't able to get up out of bed. After 7 months, her spine looks like this. Is she healthy or sick now? Look at that. She's off of all of her medications. She's living her vibrant best self. Her husband, though, this is from the front. You guys see the twist in the spine here. Is he healthy or sick? You guys see that right there? That's a surgery. It's a fusion surgery. Do you guys see this right here? No, this white stuff here is actually scar tissue. And this is from steroid injections. So are drugs and surgeries the answer to correcting the spine? Obviously not, right? What's the answer to correcting the spine? How do you correct the spine? Adjustments, everything we just talked about, the 5 essentials. He looked at these x-rays and he said this: "Doctor, you don't understand. I don't have the time, I don't have the money, I don't have the energy, I live too far away and I work too much. I can't get started right now. But I will get started, I promise." And he did. And his spine looks like this. Is he healthy or sick? You guys see the fusion surgery? It's burst right there. You guys see this big white thing here? Does anybody know what that is? This big white thing here is a morphine. His bloodstream is being pumped with morphine 24 hours a day, 7 days a week. So did he come back into the office because he got a better job, found more money, moved closer, gained more energy? His why got bigger. His why got so big because he was told that he had stage 4 prostate cancer. So he came in and he said, "Doctor, everything you told me is true. I want to get started." But he waited too long and he succumbed to the prostate cancer and died within 4 months. All right, guys, I'm not telling a story because I want to scare you. The reason I'm highlighting this story is the importance of getting started. Because right now you guys are standing at a crossroads, and we're always going to be at that crossroad. You can decide now to take a step towards prevention and living your epic life, or you can make a decision later. And that decision is going to be made when you're given a diagnosis of a disease. Because right now in this country, 4 out of 5 people are going to be told that they have diabetes, cancer, or heart disease at sometime in their life. Do you guys want to be the 4 people, the 4 out of 5, or the 1 out of 5 that's told that they're not? So guys, the answer to living a life is the 5 essentials. You just have to make the decision to get started. Now, we never turn people away due to financial reasons. So no matter what, we have to make sure we're finding a way to get started here. So one thing I don't want to hear when we're looking over these x-rays is, I have to think about it. So I know what that means. It means no. Make sense? All right, so this was a 11-year-old girl in the office. You guys see your spine here? This is a healthier sick girl. She has scoliosis. Her mom saw these x-rays and she freaked out. She took her daughter over to a neurosurgeon across the street. Within 24 hours, this girl had, now when you see a neurosurgeon or any surgeon, what are you gonna have? Surgery. So she had her spine split open, the muscles peeled back, she had rods put into place, and they beat her spine straight as they could. What do 11-year-olds do? They grow. So she's gonna grow out of this surgery every 1 to 2 years and require a new one until she's about 20 years old. Now, why was the medical system so concerned about this problem here? It was due to pressure on the nerves. Scoliosis is known to take 15 to 18 years off of somebody's life due to cardiovascular conditions, due to the pressure of the nerve going to your heart. Now, when it comes to scoliosis, you have to have a 10-degree curve in order for them to even diagnose it as scoliosis. You guys remember the test we used to do in school? It has to be a 20-degree curve, so I call that the too late test. Now, if this was your daughter, or your friend's daughter, or your niece, or your neighbor, or your coworker's daughter, or anybody you guys know or care about, when would you want them to know this was going on? At 10 degrees or 8 degrees? Yeah, at 1 degree, right? You guys, I just had a son that was born. He's about 4 months old. My wife is a rock star. She's a health coach. She exercised the whole time. She got adjusted the whole time. She didn't put anything in her food that was toxic, ate advanced spinal 100% of the time, did her spinal hygiene, and she gave birth at home naturally with no medical intervention at all. My beautiful son came out perfectly, and within 2 hours, I checked him for subluxation. Did I check him for subluxation because he came out and he said, "I'm so lucky, I have a dad as a chiropractor and I'm in pain right now, please help me out"? No, but the birth process can be traumatic on some children. So I wanted to check my son because I want him to live the most epic life possible. So I checked his spine, the top bone, the atlas, was shifted to the right. So I simply just place my hands, just like, imagine if you're like denting a tomato or an avocado, just that light force and moves it to the left. Imagine how much better my son's life's gonna be. He's not gonna be like me, who had to wait until they were fat, overweight, and given high blood pressure medication before he's gonna take charge of his health. So guys, the same care that I give to my wife, to my mom, to my son, I'm giving to you guys. And I wanna make sure we're also taking care of you first, but we need to make sure we're taking care of your friends, your family members, your coworkers, the people you guys are surrounded with, because we love them too. And you're gonna get the best results possible if they're with you. And who's gonna tell them about this? It's not gonna be the news, right? It's not gonna be Facebook, it's not gonna be Instagram. Who's gonna tell them? You guys are. Last one I'm gonna show you, this is another child. You see how straight his spine is? Is this a healthy or sick kid? He's a sick kid, but he has no symptoms yet. When his mom sat through his workshop and she said, everything makes sense, and I want my kid to live the best life. So after a few months, his spine was like this. Is this a healthy or sick kid? It's a healthy kid. Imagine how much better his life's gonna look like. He's not gonna deal with the conditions we have to. He's gonna be living a long, vibrant life, and that's what we're gonna take steps towards today, guys. So the next steps are, we're gonna bring you guys back one-on-one. We're gonna look over your x-rays and we're gonna go over exactly how we're gonna start here. Sound good? All right, I appreciate you guys. I'll be right back with you.